Difficult to put a number, a figure on the cost, particularly to the business travelers. Malaria is a major cause of disease and death, as you know, on the continent to everyone. It is not just the business traveler, it is also the fact that the population that is suffering from malaria might not be able to produce. I don't think there's any economist that would be able to give you a figure, but it would seriously disrupt the way the country works, also because people might decide not to come. I can't put a figure directly to it, but it can be a serious intrusion.
What steps are being taken to battle diseases like malaria in the context of using our own research and innovation?
The key difference between this conference and any other conference where you would find the word health research in the title is that usually if you would have a malaria conference, then people would focus on malaria, and it would be scientists, maybe policymakers if you need a campaign. This particular conference wants to put the innovation part of it, and what we mean by that is the research would create the knowledge. Then we need somebody to change that into a technology or a drug or a procedure, and then we need somebody to scale it up, and usually that is business, because governments and academia, they are not good. They are good at research, they're not good at scaling up and producing. So this conference really tries to bring together business, government, non-governmental organizations, the media, also international organizations, to try and come to partnerships that would deal with the biggest problems in Africa. And guess what? If you really start dealing effectively with the health problems by producing anywhere to scaling up, you will find that the job creation interest of ministries of finance suddenly becomes higher. So we're very keen to get this link to business, which is not an easy link for public sectors to make. So this forum is really different in that sense. We heard from a very good example in the malaria field out of Tanzania, for example, perhaps at a lower level of economic activity, but still an important case, where research over the years has led to the understanding that insecticide-treated bed nets are very important to prevent malaria. When that was discovered, the production of it was started up by a small enterprise in Tanzania, but because of the global problem, a global institution came in, started dishing out insecticide-treated bed nets, but couldn't really get into the periphery because the health sector doesn't have the system of distribution that business has. So what happened is that they actually ruined the local startup company of the bed nets, and they didn't really produce in the distribution. The subsequent phase was that the big global company or the big global fund withdrew and left it to the local company to produce under a license and local small business to distribute it. And right now we understand that 60% of children in Tanzania sleeps under insecticide-treated bed nets, is a substantial reduction, and that this small industry now employs 7,000 people and produces half the world's bed nets. And that is the great combination of preventing a health problem, doing something really about it, and getting business involved to make it happen.
How far away are we from finding a solution to malaria?
It is very difficult to predict. The ideal would be that you would have a vaccine trial coming up. There are promising things in the pipeline, but they were there also 5 years, 10 years ago. It is a bit like HIV/AIDS. It is a very hard bug to beat, so to speak, and I would not want to risk my neck to say in the next 2 years there is a treatment. There is a treatment in terms of medication, but not in terms of vaccine prevention.